Now, therefore, be it be proclaimed on the second day of September 2025 by the Pierce County Council and Executive that September 2025 is hereby designated as Suicide Prevention and Awareness Month in Pierce County, Washington. We encourage all community members to learn the warning signs of suicide, speak openly about mental health and challenge stigma, promote hope, compassion, and connection, and share available resources, including the 988 Suicide and Crisis Lifeline. Thank you. Thank you for being here.
Yes, thank you all for being here this afternoon. We're going to invite you to speak if you want to come to the podium and say a few words to the council and community that might be listening in.
Good afternoon, County Council members. I'm Thelma Brown, President of the Gig Harbor Key Peninsula Suicide Prevention Coalition, and with me today is Joan Nelson, our Interim Secretary. It is an honor to be here today on behalf of the Coalition. I want to thank you for your contribution. Your support is truly appreciated, and it will enable us to have students trained as youth mental health first aiders. These students, in turn, will be able to help other students, their family members, and individuals from their communities who are experiencing anxiety and depression due to harassment, intimidation, bullying, or discrimination. This past school year, we implemented and are now supporting Circle of Friends clubs at both Gig Harbor High School and Henderson Bay High School. After being trained as first aiders, the members of these clubs will be better able to support one another as well as their peers. This year, we are planning to expand these Circle of Friends clubs to include Peninsula High School and the middle schools in the Peninsula School District. We have also purchased mental health curricular materials to be used at the various schools in the district. Your generous funds have enabled our coalition to support students and adults of our community, both emotionally and socially. We appreciate you for supporting our important mission and cannot thank you enough. Thank you.
Thank you. Anyone else?
Thank you so much for allowing us to be here today. And AFSP, looking at everybody in the room, how many people in this room by a show of hands knew what AFSP was? Yep. This is what, thank you. This is what happened. I took this position over about 3 months ago. I've been in the nonprofit world about 25 years, and the one thing I did is I went out on the streets and I asked people. The one thing most people are unaware of is what AFSP is not a suicide hotline. What we can do is we can teach you the warning signs. We can teach parents, teachers, anybody the warning signs. We have 35 different programs that are all free. We want to get people out there and to know about it before it's too late. We get so many phone calls weekly, and I apologize if I get emotional, but it's too late at that point. They want to know how. Let's get proactive and look together, because honestly, there is a solution out there. And with AFSP, we are branching out for advocacy, support, and everything else we can do to try to reach everybody. The goal is to get more people involved, to understand it, and to realize when you walk out to one of our walks, we have a big table full of beads. Every bead means something different to you. When you put these beads on, you turn around and you see 1,000 people in the same spot you are. This brings us together. This creates that non-stigma. We just got a grant that was approved to help work with the construction industry. They are 5 times more likely. Most people are unaware of that. So we are putting a lot of efforts into that, but unfortunately there's a lot of them. A lot of different areas. I am a vet. I have experienced things in my own personal life and gone through it. I know most people in this room have. But there's hope and there's a way to communicate with us, so thank you for letting us be here and acknowledging September is that month, but in all reality, every month should be awareness. So reach out to us if you'd like to learn how to recognize the signs or go through something. We're here for the 135 people that each one suicide can affect. Help you maintain and move forward. Thank you.
Thank you for your comments.
Thank you, council members, for the opportunity to talk about this important matter. As a child and adolescent psychiatrist at Tacoma General Hospital, I have the privilege of working with youth and their families at what many consider the lowest point of their lives, after their child has attempted suicide. I talk with teenagers every day about suicide. Many might consider what I do very depressing. I feel quite the opposite. I really love what I do because if I am talking with an adolescent, that means that they're alive, and that means that there is hope. In 2024, the Pierce County Medical Examiner recorded 124 deaths by suicide in our community. That's 124 too many. Of those, 75% were male. We know from national data that Indigenous men have the highest rate of suicide, followed by white men. In addition to being home to members of the Nisqually, Puyallup, Muckleshoot, and Squaxin Island tribes, Pierce County is home to other populations that are at higher risk for suicide. These include veterans, active military, those in rural areas, and our elderly. We also know that the rates of suicide among minority populations are increasing. Those in the LGBT community continue to have high rates of suicide attempts. In Pierce County alone, between the years of 2021 and 2024, 3 transgender youth died by suicide, accounting for 10% of the adolescents that died by suicide during those years. That is a disproportionately high rate. Of the 124 Pierce County members that died by suicide last year, 71 of them died using a firearm, making it the most common means of suicide. Among youth, asphyxiation was the most common means. I'm not sharing these statistics to discourage us, but to motivate us. I am fortunate to be a part of a number of initiatives that are addressing suicide in our community. For the last 4 years, in partnership with a colleague at the University of Washington, Tacoma, I have provided training seminars and consultation for counselors at Tacoma Public Schools. And thanks to the help of Councilmember Denson, I've connected with the counselors at the Peninsula School District, and they will also be joining us this year. We're really looking forward to that. And also, it's very important that we're incorporating Peninsula School District because unfortunately they have had a very high rate of youth suicide. And hopefully this initiative is one step in helping to address that. Another project I'm working on is with Mary Bridge Hospital and Kids Mental Health Pierce County. We are partnering with Franklin Pierce School District to revise their suicide prevention and response protocols. And lastly, as part of my work with MultiCare, my team and I are launching an intensive outpatient program located in Lakewood for depressed and suicidal adolescents. It is set to launch in 2026 and will be the first program of its kind in our county that will accept Medicaid patients. Not only will this program teach teens the skills they need to manage the stressors of life, it has the potential to reduce emergency department visits and costly hospital stays. I have learned that this work cannot be done in isolation, and I am very lucky that I have found quite a number of excellent collaborators here in Pierce County to do this work. That is something that also gives me hope. Thank you.
Thank you for being here.
Hi, thank you for having me today. It's an honor and privilege for me to be amongst all of you today. My name is Nicole Vreeland. I am a Pierce County resident, and I like to say I'm on the Friends and Family Plans of service members, veterans, and families. I am here today on behalf of your Washington State Department of Veterans Affairs, and I thank all of you for your service, as well as for those in the crowd. I appreciate all of you and the valuable service and sacrifice you have made. Pierce County is home to about 90,000 veterans and their families, and our friends at Department of Health has notified us that last year in 2024, 212 veterans lost their lives to death by suicide. This year so far, 18 has lost their lives to suicide. And as grim as that may be, there's still work that needs to be continued. And we are, it's an honor and a privilege to continue serving veterans, not only in Pierce County, but statewide. My team is the suicide prevention team as part of WDVA's overall program. We provide support, education, and training to the community to combat stigma among military members, service members, and then offer support and just services to veterans and their families statewide. So I think it's important to note, of course, the 988 that was mentioned. Veterans have their own crisis line, so you can call or dial 988, press 1 for the Veterans Crisis Line, and our partners at the Federal VA also have a team that monitors every 24 hours the callers that come in for each of the states, so that way there's follow-up. Washington State is also part of SAMHSA and the VA's Governor and Mayor's Challenge to prevent suicide among service members, veterans, and families. We entered this initiative in 2020 and continue on as Governor Ferguson has recommitted Washington State to this initiative. So Washington State Department of Veterans Affairs does a fantastic job at not only connecting veterans and their families to their earned benefits, but to make sure that we have support for everyone that's involved statewide. So Pierce County is a pivotal part of our state's veteran community, as we are home to one of the largest military installations. In addition to the 988 promotion, we also work in partnership with Department of Licensing and offer a license plate emblem where it says 988 Lifeline, there is hope. And 100% of the proceeds of that sales of the emblems go to a community-based grant fund for suicide prevention. It gets awarded to community organizations that provide peer support services and suicide preventive services to veterans and their families in the community. In addition to the trainings that we do a learn suicide prevention training as well as the combating stigma training, free and no cost, either virtual or in person, to anybody in the community, to ensure that community members and others, healthcare professionals, et cetera, are equipped to work and understand how to work with military and their family. We also have the Staff Sergeant Fox program, which is another suicide prevention program that is funded by the federal government that offers outreach, case management, and peer services to veterans that are high risk of suicide. So I thank you for everything that you do, the support you all give, and again, I thank you for your service and sacrifice in helping our service members, veterans, and our families, and helping Washington State Department of Veterans Affairs continue our work each day.
Thank you so much for your comments. I'm going to look to my colleagues to see if we have any additional comments. Vice Chair Herrera.
Thank you, Chair. Thank you for all the work that you do, that everybody does up here today. We do this every year because this council thinks it's very important in all different aspects. You know, again, I got to talk about my police career and, you know, meeting folks at their lowest points sometimes, from the Native American community, from all different communities, and it's a real thing. And having to talk to families who just experience this in their family, it's a tough thing. And also from the veterans community, you know, we know that they have a higher rate of suicide, and there's a term that some veterans talk about how you know, their soul died over in the war, but they didn't fall down until 15 years later. Now, sometimes us veterans, through programs like the Washington Department of Veteran Affairs, who get out in the community and teach other veterans how to connect with their battle buddies, but sometimes go back and find that person's soul that they left in Iraq or Afghanistan and bring it back home. We really appreciate some of that work there. I also appreciate things for the families, like Out of the Darkness Walk. That is absolutely amazing. Because families, what the old stigma is, it's a family thing, and you just silently be in pain for years and years and years and blame yourself and things like that. But this is a day where we talk about all that stuff to prevent it, because I think someone also said by the time we can't wait until they're about to do the act. It's almost too late. So before that, we need to be educated. We need to not be ashamed to talk about it, and we need to know the signs. So thank you for all the work that you do. Thank you, Chair.
Thank you for your comments. We're going to go to Councilmember Yambe.
Thank you, Madam Chair. Thank you for everyone for your work on this incredibly important issue that often, is not always discussed even now, and is a very difficult topic. I am tremendously grateful that we have more and more youth peer-to-peer support systems in place and doing more. I still remember in middle school where one of my good friends was lost to suicide, and not having the resources and not having the trainings, myself, it would have been nice to have those resources. And there's nothing like being able to be support to your community and your friends and be a resource that, sometimes you wish that was there. And so thank you for all the work that you do that goes unnoticed and often underinvested, because we don't like to talk about these things. We like to, think that everything is, going well and it must be a deficiency in character or something, and it's really not. And thank you for daylighting these issues. Because I know that, in my own communities, Native Hawaiians and Pacific Islanders have high rates of suicide, whereas, Asian Americans, I think, is a little bit lower. But there's those deep shame levels and depression and anxiety and constantly thinking that it must be yourself that's the issue. And so, not to mention the veteran population who, we all need to do our part to make sure that people know that they're valued and they're supported and there's places to go to talk. And so thank you for your advocacy, and thank you for my colleagues for recognizing this very important day and issue.
Thank you, Councilmember Yambe. We'll go to Councilmember Morrell.
Thank you, Madam Chair. I appreciate the collaborative effort that you've brought before this council. As some of my colleagues have said, this is somewhat of a somber day for a lot of us, but yet knowing that you're out there making a difference is huge. Now that mental health is kind of at the forefront of a lot of issues that we're dealing with, and this council is invested in behavioral health in the last 4 years to try and move resources out into the suburban and rural areas, not just the urban areas. And one of the groups that I constantly hear, District 1 is a very large district, takes in most of the agriculture that is in Pierce County. Washington State Department of Agriculture released a mental health and suicide prevention report on ag producers and workers. Suicide rate in Washington State is 25% higher than the general population. Financial pressures, economic uncertainties, commodity costs, labor cost of just doing everything has gone up substantially. And though they love what they do, they're very passionate, farmers are susceptible to what the economy is doing, trying to bring the products, the produce, and the other things that we need as society members to live a healthy life. And a lot of legacy farms are gone. They're leaving, never to come back again. And between 2017 and 2022, Washington State lost over 3,700 farms. Those were family members of third, fourth, fifth generation that had to walk away from what they loved and what their previous generations built up just due to the fact they couldn't make the payments anymore. So we struggle in all areas. And in dealing with this, I just wanted to highlight what other sectors are dealing with beyond the youth, beyond the adult. There is a very high rate amongst farm and agricultural owners. So thank you. Thank you, Madam Chair.
Thank you for your comments, and thank you for sharing the perspective. I will conclude with my gratitude for the work you do every day, the lives that you touch and save, and the community members that you help deal with grief as they're trying to figure out why. And something that resonated with me in the proclamation, it talked about limit access to lethal means. And we've had, in 2023, over 27,000 people committed suicide using firearms in the United States. That's just over the population of Bonnie Lake by a couple thousand. And we have the ability as a people to do something about that, and we continue to kind of walk around it instead of trying to actually do something. So again, as we think about how we can save lives, limiting access to lethal means in a moment of passion or depression or anxiety or anger is something that we could do, and we just continue to choose not to. But truly believe and appreciate the work that we continue to do, and we're going to take a photo and try to be thankful that we're doing this work. Thank you.